So, context is important here. Norway, like most other Western countries, is prioritizing elderly people in nursing homes to get the vaccine first. So, the Norwegian Medicines Agency, that's the regulator in this case, was quick to point out that these 23 people who died after receiving the Pfizer-BioNTech COVID-19 vaccine were elderly and frail to begin with. The agency also said that all deaths that occur within a few days after vaccination are looked at closely. So of the 23 in this case, 13 have been assessed so far. And here's what the vaccines regulator said in a statement. In Norway, we are now vaccinating the elderly and people in nursing homes with serious underlying diseases. Therefore, it is expected that deaths close to the time of vaccination may occur. We cannot rule out that adverse reactions to the vaccine occurring within the first days following vaccination, such as fever and nausea, may contribute to more serious course and fatal outcomes in patients with severe underlying disease. So Pfizer, the vaccine manufacturer, said that it is working with Norwegian health officials to gather all of the relevant information, but insisted that the number of incidents is not alarming and that it's in line with expectations. Now, these types of deaths may not be unique to Norway. Officials there are quite transparent when it comes to publicly reporting any adverse reactions to COVID vaccines. But for instance, the UK's vaccine regulator couldn't say how many people, if anyone, had died after receiving a COVID shot in this country, but promised that that data would be published at some point. Scott McLean, CNN, London.